Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. And the number to call right here in the studio and talk directly to Dr. Darrow is 866-870-5752. That's 866-870-5752. And don't you want to check out the website, too, at www.lastemcells.com. That's lastemcells.com. What do you think, Dr. Darrow?
I love it. So I just want to mention when you guys call in the show, which is at 866-870-5752, you get a copy of my new book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got about 250 studies on why surgery for musculoskeletal issues is becoming, as Nita says, arcane, outdated. There are reasons for surgery, obviously, but my own point of view, don't do them for rotator cuff tears. Don't do them for meniscal tears. Watch out if you've got spinal stenosis. That's not necessarily a reason to have surgery. Herniated discs. I see these things all the time where it's not really the issue. I have to do an examination and make sure where your pain is being generated from. And now it's Punish Nita time. Ready, Nita? Actually, it's
ready. Joke number one, here it comes. And you can save me by calling and interrupting this conversation. So you can talk to Dr. Darrow at 866-870-5752. Please call now and save me. Thank you. Go ahead.
Live, you can call me at the office, 800-300-9300. You ready, Nita? You've got 1 second. You've got 1 second to answer.
I'm ready. Usually you give me only a nanosecond, so that's progress. Go ahead.
Hopping away. A receding hairline. Bad, huh?
Ooh.
You ready for the next?
Oh.
How did the hipster burn his tongue?
Yeah, ready.
Close. He drank his coffee before it was cool. But I like yours too. That was good. Can you take any more?
Oh. Okay. Well, let me just tell people how to get a free book today. 866-870-5752. Call that number, and you'll get us right here in the studio, and you'll get your free book. And it's really smoking hot. 265
Why did the kid stock
scientific
up on
studies.
yeast?
Go ahead.
Oh, you were so close. He wanted to make some
bread.
dough. Linda, you saved Nita.
Okay, let's go to Linda in Ventura.
Person. So I understand. Yeah, we're going to send you goodies.
I'll send you chocolate, Linda.
You got to talk louder, Linda. You can scream at me. You're not going to hurt my feelings. I understand. By the way, this is Dr. Marc Darrow, and I do regenerative medicine using platelets, PRP, and bone marrow stem cells. And I use it on musculoskeletal issues. I don't heal any diseases. You know, things like neck pain, back pain, shoulder pain, elbow pain, wrist pain, finger pain, all the way down to the toes. So I understand, Linda, that your low back bothers you. How long has that been going on?
The initial injury, I'll call it, happened in my early 30s, actually. I'm 58. I have degenerative disc disease in the lower back at 3 levels. And I was actually just driving back from my third MRI appointment and was listening to you on the radio. And it's like, yes, I know. It's like, okay, maybe I should pay attention to this because regenerative medicine, I feel like, it needs more attention. and it definitely has mine. I've never tried it, but it's something that
Sure.
I'm very conservative when it comes to surgery. But this
Oh, my
last
goodness.
incident, like I'm
so
not able
sorry.
to walk. Actually, I can walk for about 5 minutes
Okay.
before I have to sit down. And
Do you
I'm
have any
very
pain
active,
down your
very
legs,
active.
Linda?
So it's very.
Okay.
Most of the
Okay.
pain is in the lower back on one side, the right
Okay.
side, and the X-ray showed some scoliosis
Okay.
related to the degenerative disease and some arthritis. So I've been told by a couple of different back surgeons that, like
Okay.
disc replacement's not an option. It has to be a fusion. And I'm looking at follow-up appointments
Okay.
beginning next week to discuss
Sure.
my treatment options. Because I'm to the point
Okay.
now where I literally have to. I walk for 5 minutes and I have to
Where
sit
is
down. And then there's numbness,
top
which
of
is
your
new.
thigh.
The top part of my thigh is top part of the anterior thigh, the full anterior thigh, about halfway down, not all the way to the knee, but a very specific area.
Okay.
With loss of dermatome sensation there, and just
Wow,
a lot
you
of
poor
pain
girl.
unless
I'm
I'm
so sorry
sitting
to hear
still.
that. So, I have a lot of things to tell you. So sit back and enjoy the ride. Okay. This is another great situation. Terrible for you, but great for medical talk and people listening to this. So number one, that area around the anterior thigh is the distribution of the lateral femoral cutaneous nerve. Okay, write that down. Okay. Yep. And
lateral femoral
it's called,
cutaneous
the syndrome
nerve.
is called neuralgia paresthetica.
Okay.
Ha! Neuralgia paresthetica.
Could you repeat that?
Now, I'm not saying you have that because I haven't examined you, but I'm just letting you know that may not be coming from your back. Now, from the things that you told me, you don't deserve a surgery, okay? And here's the reasons why.
I will do anything. What really got my attention was the discussion you had with the last gentleman that called in, the golfer. I had 3 different doctors, all from very well reputable places, like Curlin Job, Stowe, UC Keck, 3 shoulder specialists tell
How's
me
your shoulder doing
that
now?
I need a rotator cuff
How does your shoulder
surgery.
feel? Okay.
5
What does that tell you?
They're
what does
great.
that tell you?
I didn't have surgery. I had some, yeah, exactly. That's why I'm not one for jumping into surgery. So
Okay.
I also suffered with frozen shoulder on 2 separate occasions. I agreed to a manipulation, which worked well for me, and then I just went back to my normal activities once the pain resolved. And it's just your body. You have to give it time. It takes time to heal, and to jump into a surgery, I've actually made the mistake of doing that when I broke a finger last year. It never did heal correctly, so I kind of wish I hadn't jumped into that so quickly. But I had a tendon that was torn, and
so Linda, here's the funny thing: I don't need to do this show anymore. You can start doing it. No, you're speaking. You're preaching to the choir here, because everything you're telling me is exactly what I talk about on the radio. And I just read an article. Let me do a little talking now, because I got so much information. You're going to get me confused. Number one, I need to give out the phone number for when we're finished with you for other people who want to talk to me live, and the number is 866-870-5752. That's to the studio. The phone number here to talk to me live is 866-870-5752. You can also go to the website and watch videos of me doing these procedures all over the body. See if it's something you'd like to do. It's a lot simpler than getting a surgery, having your own cells from your own body injected with a little needle. And that website is www.lastemcells.com. I'll repeat it, www.lastemcells.com. And on every page you can email me from there. I get emails all day and all night long from all over the world. And my wife is always saying, "Why are you on your computer so much?" And I go, "I got all these emails I got to answer, and it's fun." So I answer emails from when I wake up in the morning till when I go to sleep at night, in between patients, and it really is a lot of fun talking to people that way. And for those of you that want to call me at the at the office, is 800-300-9300. The office number is 800-300-9300, and we'll talk to you there also. So let me start from the top here. You have DDD, that's degenerative disc disease. The discs are little cushions between the vertebrae, and most people that have that don't have back pain, okay? Got that? Okay. That's not a reason for surgery.
That's
Number two. And by the way, regenerative medicine using platelets or stem cells often can increase the disc height. By doing it, even in the ligaments, it can increase the disc height. The disc degeneration generally comes from instability in the ligaments, so they loosen up, and then the pressure is on those discs from the vertebrae. So they start squishing down, drying out. That's number one. Okay? Number two, scoliosis doesn't typically cause back pain unless it's very, very severe, and you don't sound like yours has enough of a curve because you're active. Okay? Third thing, osteoarthritis in the back doesn't usually cause back pain or in the neck. Okay? So you've got three issues there already where I can probably help you. I can't tell you until I examine you, but I can probably help you. Now, the thought of getting a back fusion to me is hellacious. I get people in all the time who have had a fusion who got a lot worse.
Me too.
Okay? For what you have going, the degenerative disc disease, scoliosis, osteoarthritis, I don't think you deserve a fusion. And there is an article that I can send you. I just read it yesterday in a medical journal saying that fusion is the worst surgery on the planet. Overdone by doctors. Shouldn't be done in most cases. Okay? It's sitting right on my desk. If you want a copy, you go to the website
your body
at www.lastemcells.com, and you ask me through an email, which you can do on every page, for that article why back fusions are terrible, and I'll Xerox it and I'll send it back to you. Okay? I'm not making this stuff up. I've always known this.
Oh, I want to turn around and just based on my own personal experience, my neck went out. I just went through this with my neck. My neck, I had excruciating pain in my neck. I went in for an MRI. They said, you need a fusion or a disc replacement, but you're more a candidate for a fusion because of your arthritis. I went to physical therapy. I did some traction. I was pretty diligent about that, like twice a week for a few weeks. The shoulder was involved. I kind of felt like it was like a dual issue because I had a lot of crepitus in the scapula, and it was all kind of connected. And I just literally
I love to hear that,
and it was gone. I was completely pain-free. And I thought to myself, what if I had gone in to have a
I had the same
fusion
thing happen
when
with
it really
my
wasn't
wrist,
necessary?
which was my first kind of nasty injury. And everybody said, you need a steroid shot, and if it doesn't work, then we're going to do surgery. These are my buddies telling me. Guess what I did? I injected myself with regenerative medicine. The next day, it was 50% better. I had to do it a few more times, and I haven't noticed any wrist pain. I can't remember how long. It's got to be 15 years. And I can go play golf, which I'm going to do later today, lift weights and do whatever I want. I don't have wrist pain. So, I don't know if you know my story. I did have a surgery on my shoulder when I was, I'm going to say, a dummy in med school, and it blew it out. It screwed my shoulder so bad. And then I didn't learn about regenerative medicine until years later. I injected myself, and it healed overnight completely. That's not typical, but it does happen. I had the same kind of a thing with my low back, and I had a friend inject it, and the next morning it was gone. The pain was gone. So if you saw an x-ray of my back, you would say, I need a fusion. It looks awful. I have something called DISH, D-I-S-H. Okay? It's an autoimmune type disorder, and it fuses the vertebrae. So if you look at my vertebrae, it looks like there are spikes coming out of it all over. It's all fused too. Well, guess what? I got better just being injected with regenerative medicine. Did it fix the DISH? No. That's a syndrome that I'll most likely have the rest of my life. It's a very slow, ongoing type of a thing. It's a form of arthritis. But I'm doing well. Okay? I'm not getting that fusion, and I hope you don't either. But I can't tell you anything for sure.
I haven't talked to many people that have had those kinds of surgeries that have had success. I just met a woman yesterday at the grocery store, of all places, Trader Joe here at local, who, she saw I was in pain. I was bent over, and I was telling her about my situation. And she said, I feel for you. I've had 5 back surgeries. And I looked at her, and I said, why 5?
You know, the stats on that show that if you've had a back or neck surgery and it didn't work,
and
the chances of a second one or third, fourth get less possible to heal the area, make you feel better.
It's going to happen. All the doctors have said if you have a fusion, most likely.
And you know why that is? Because the area that's fused is immobile.
5-10 years
So
down
the
road.
area above and below the fusion takes all the stress that would have been taken up by mobile vertebrae and mobile discs. So not a good thing. I'm going to give out the phone number here again. Write this down. If you want to talk to me right now, I would love it. Phone number to the studio is 866-870-5752. And if you want to grab me at the office sometime, 800-300-9300. There are people by the phones most of the time. If you call the office and no one is there, just leave your number. We'll get right back to you. Well, you're amazing, Linda, and I'm so happy that you're staying away from surgery because you're letting... Yeah.
I'm trying my best.
And I'm the same. I've been told that I need surgery on a lot of parts of me by my buddies, and I've refused and gotten better just injecting myself with PRP, platelets from my own blood or from stem cells. I've done very, very well. I can't think of a part of my body that it hasn't worked on so far. That's a big statement.
Well, I think it's time for me. Well, I'm at the point now. I'm in so much pain, and I'm so shut down, debilitated currently. That's I can't. This is not how I want to live my life. And there's no guarantee that a surgery is going to make it any better. So why not?
Well, I would definitely do regenerative medicine if I were you because it's easy. It's simple. You walk into the office, you get some injections, and you walk out.
Right.
What happens with surgery after you do a surgery? Not that simple. There's all kinds of possibility of side effects, and I don't want to implant terrible things in people. But I was in a surgery when I was an intern, where the woman actually died right on the table, and it was not a big deal in terms of the surgery, but it was a big deal to her and her family because she's not here anymore. One of my patients, against my good wishes, had a surgery on his knee, and he didn't die on the table. He died 2 weeks later from a blood clot from the surgery. So, our culture is to do surgery, and it's changing. Regenerative medicine is being taught all over the world right now. And I have doctors who come. It is fascinating. I have doctors who do come from all over the world to train with me. And I did teach it at UCLA for 20 years to the physical medicine rehab department. And most of my students, if you might want to call them that, are out doing regenerative medicine now. It's simple. It's easy. Very little in the way of side effects. The biggest side effect from getting injected with your own platelets or stem cells is you get a little bit stiff in the area where you've been injected. You get stiffness for a day and a half. That's pretty common. But so what?
Right.
I mean, the worst thing that ever happened to me, self-injecting,
Well, if
I injected my elbow. I had lateral epicondylitis from playing tennis and lifting weights. And that elbow was stiff for 2 weeks. Made me real nervous because it was back in the day when I was just experimenting. I didn't know anything. And I didn't know who to call to say, hey, what am I going to do? My arm was really stiff. And then I woke up 2 weeks later in the morning, and it was completely healed. I've never had a problem there since. It's been, my gosh, it's been at least 15 years. I've been injecting myself for over 20 years with great success. So it's not going to help everybody.
That's fantastic. I wish they would.
So Linda,
So
I
all
would
need
love to
do is
see you
just call
and
schedule an
examine you.
appointment and come
I've
and
got to
see
get
you
my
and
hands on
hope
the
for the
areas
best.
to tell you what's going on. I don't trust MRIs at all. I do not trust X-rays. I have people almost every day who come in with terrible imaging films, and there's not much wrong with them. I had a woman come in on Friday who had thumb arthritis, both sides, and she was told she needed surgery. And I moved her thumbs around, played with them a little bit, and I said, you don't need a surgery at all. Not one bit. And if you've ever seen surgeries on hands and fingers and toes, I've never seen them come out too well. Yeah.
Well, I can show you mine.
Yeah. Anyway,
The last
God
one
bless
was a
you.
disaster. I don't
Thanks
feel
for
as
calling
though
in.
this can
I'm going to
Yeah,
give
well,
out
thank
the
you so
phone
much
number
for your
again
time.
to
I
the studio.
appreciate it.
We've got a couple of minutes left.
Thank you,
The
Linda.
phone number here is 866-870-5752, 866-870-5752. And the number to my office again is 800-300-9300. That's 800-300-9300. And I'm the website, of course, you can watch videos on the website or email me through that is www.lastemcells.com, lastemcells.com. So we've got a few minutes left. I'd love to hear from you. We've got another caller coming in. In the meantime, I want to mention that we do the vampire facelift. Remember that name, vampire. We inject the same cells that I use on the musculoskeletal system to heal the joints, ligaments, and tendons, and we inject that into the face. And we regrow the tissue in the face, make people look young again. I'm going to go to Desiree. You have a problem with your knee. Desiree, how long has it bothered you for?
Well, I have an acute injury. 5 months ago, I completely ruptured my ACL and grade 2 tear on my medial meniscus. And I was just wondering, I know everyone's different, but is that
Very much
something
so.
that you typically
Yes.
have had favorable results?
I'm glad that you've held off doing surgery
Yeah, really.
because a lot of these things just heal on their own. Okay? I would have to examine you. I'm sorry, go ahead.
Well, I've come quite a while. Yeah, okay. Oh, I was just saying I have, definitely seen a lot of improvement, but I'm, definitely not where I want to be. I still can't, run and jump, and even going downstairs and kind of sketchy. I need to make sure there's a railing.
Okay.
So I don't have full range of motion.
The first thing I would do with
but
you,
it's getting better.
Desiree,
It's
is I would
improving all the
put my
time. I am
ultrasound
doing
probe
physical
on your
therapy.
knee and see if there's fluid in there. If it really were a tear, it would be full of blood. Anyway, that's another story for another day. You can email me through the website, www.lastemcells.com, Desiree, and I'll get more personal with you and see if we can help you. The number to the office is 800-300-9300. Thank you so much, Nita Valens, for hosting the show. Yes.
Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens.
You've been
Thanks for
listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.